Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly COVID-19 news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and quickly introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll open it up to brief statements from our panel members, and then we'll take questions from media who are in attendance. We'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, thank you. And I hope all of you are well out there today too. Warmer weather this week, and I am grateful for it. And that's how I want to start my comments this morning, is just with a gigantic thank you to each one of you for your response to our request last week that you manage and conserve your energy use. It made a tremendous difference for our entire region. And it was because we were partnered up with good corporate partners in Excel and Atmos, but also because of you at home making the changes that you needed to make in order to preserve and conserve our energy so that we did not overload our supply and actually have some permanent shutdowns and shortages. So thank you for that. It feels good to be working as a team, not just in segments in our community, but obviously in our response to COVID, we've had tremendous strides in building a team. You see this team every week on this press conference, but they do work off the press conference together. And I know they're protecting the health of our community. But it was good to see that those team work skills have extended even outside of our COVID response, and now they're applicable to any other crisis that we have going on affecting our entire region. So we don't like crisis, and we don't like storms and uncertainty and things like that, but it is good to know that we're in a great position as far as working with our community partners, and most importantly, being able to communicate information to citizens and seeing that citizens have a trust back in those partners and our city leadership, and that you guys responded in it, and we were able to alleviate the situation. So thank you for that. Back to the previous crisis, and that is our COVID response. The Vaccine Clinic is up and open again this week, and we're vaccinating people there. I want to remind you, it's free. There's absolutely no cost to come and get your vaccine. So if you fit in category 1A or 1B, I want to invite you to come and get a vaccine. It helps you, but it certainly helps our entire community if we're vaccinating you and getting as many people as possible vaccinated. So I encourage you, if you're going to get a vaccine, would you invite someone to come with you, somebody who fits in category 1A or 1B? Let's ramp up our efforts to get people in those categories covered, because we really can't move to the next category until we've covered those people. So let's do what we can by getting ourselves vaccinated if we qualify, and inviting someone or offering to take someone that we know does qualify. Then my final thought today is just how grateful I am that our numbers are shifting and on the downward trend still. I want to ask you, help us maintain that downward trend. Please continue to wear your masks. Please continue to maintain social distancing at your events and in your workplace. I know the temptation it is to slack off on those two things, social distancing and wearing your masks. But it's what's required if we're going to maintain the downward trend in our numbers, continue to get people vaccinated, and let's push just for a little bit longer to keep our COVID protocols in place so that we can continue to keep our people safe and our businesses open. Those are the two most important things in responding to COVID. So please do what's necessary to keep maintaining this great trend that we're on. And that's all I have this week, Dave. Thank you.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you today?
I'm well, Dave. Thanks. I'm glad to be here this morning and glad to be here with you all. As of yesterday, there were a total of 32,933 total cases of COVID-19 here in Potter and Randall counties. 16,791 cases in Potter County, and 16,142 cases in Randall County. We have a total of 31,406 recoveries, and we are thrilled at each and every recovery. We are, however, up to 670 deaths here in our community, and our heart breaks for each and every family who's lost someone to this disease. That leaves us with 857 active cases here in our community. I don't remember the last time we were under 1,000 active cases, so I'm really glad about that number as well. Each of the cases do represent a unique individual. The 7-day rolling positivity rate is currently at 4%. The positivity rate at the drive-through testing site, which is a subset of that total, is at 22%, and the 5-day new case average is at 49 new cases per day. So we've really come a long way, especially since the summer. Yesterday, our GA32's hospitalization percentage was at 5.7%. That means that 5.7% of all of our hospitalized patients still have COVID-19. So we still do have work to do. Even though our RAC region, we're in RAC region A, even though our RAC region is no longer considered an area of high hospitalization, and we have moved to status level orange, in order to remain at these levels, we've got to remain vigilant. Wearing our masks, social distancing, staying home, having good hand washing, and being vaccinated when your group is called are the only way we'll stay at this level. Our public health operations, we did have to close last week due to the weather, and so we were thankful for a little bit of a break, but we were sad that we weren't serving, and so now we're glad certainly to be back open and to be serving. Monday we had another record day. We served about 3,200 people in our immunization clinic, so it was a big day. We were glad that you all came on Monday. The public health drive-through testing site is operational again, and individuals can call 378-6300 to be screened and directed to the test site. The outpatient bamlanivimab infusion center is operational and accepting referrals from local providers for patients who do meet that EUA criteria. So far, we've seen 148 patients and only 4 have required hospitalization. So that clinic has certainly been a success. If you have COVID-19 and you are in that high-risk category, if you're over 65 or have a chronic healthcare condition, please talk to your healthcare provider about this potential, this treatment. As far as the vaccination clinic goes, we have so far given 42,281 first doses, and we're up to 22,046 second doses of our total 76,950 total doses received. So we've given a lot of vaccine, and we're super excited about that. Today we'll be open until 5 o'clock, so come see us if you're a healthcare worker, or if you're over 65, or if you're over 18 and you have a chronic healthcare condition. And if this is your second dose, don't forget your vaccination card so that we can document both of those shots there on your vaccine card. I know we've talked about a lot of numbers today, so hang with us just for another minute. Our staff are working through data. We have several data sets that we're working through, and we're doing QI on all of that data. But so far, around 77% of the vaccine has been given to Amarillo or Potter Randall County residents, the vaccine that's been given through the public health clinic. Another 93% of the vaccine to those people who live in the Texas Panhandle, and only about 6% of the vaccine has been given to people who live outside of the Texas Panhandle. So we're definitely vaccinating people that live right here at home. I expect these numbers to be adjusted slightly as data is continually added every day and QI is continuous. As I said yesterday at City Council, I am certainly thankful for our community's support. You've come to be vaccinated in big ways, and you're supporting our team in big ways. We've had some incredibly generous gifts of donation, gifts of gratitude, brought thank you cards to our team. The snack pack for kids brought our team thank you bags. Youngbloods, the Big Texan, Faith Builder Sunday School class at Hillside Christian Church, Amarillo National Bank, Happy State Bank have all provided lunches for us. And then we've had just individuals who, out of the kindness of their heart, have brought donuts and water and different snacks. And so it's between the generosity of our community and the hard work and dedication of city staff, I think this is truly what makes Amarillo great. And we are truly a great community. So I just want to say thank you. And that's all I have, Dave.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you today?
I'm good, thank you. Yes, it looks like the numbers are better and hospitalizations are much improved. We'll have input from our doctors here in a minute. But once again, I think it's for three separate reasons. We continue to wear masks. We've vaccinated a significant number of people, and there's been a significant number of people who have become infected and recovered. So I think those are the main reasons that our numbers are better. A couple other comments I was asked to make. Ivermectin is very good for parasites, but does not work for COVID. There's a new vaccine that is going to be probably out on the market soon, the Johnson & Johnson vaccine. I think they received EUA authorization this morning. And we're going to have another choice. That's going to be a great choice, I think, because it's only going to be one shot. And so logistically, that's going to be much better. It's clear that it reduces severe disease and hospitalizations. And so I think that within a few weeks, we're probably going to have a surplus of vaccine in this country, which is a wonderful problem to have if you want to look at it that way. I think another question that may be answered in the near future is the risk of transmission in individuals who've been vaccinated. And it looks like there is some data that's starting to emerge that in fact is suggesting that there is a significant risk reduction of transmission in individuals who've been vaccinated. So I think that we'll keep our ear to the ground on that. But once again, I think this is all good news. And as time goes on, I think things are going to continue to get better. So that's all I have this morning, Dave. Thanks.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Good morning, Dave. So I am highly encouraged by the continued improvement in the numbers related to COVID at the healthcare facilities here, as well as the general community. Now we're about 3 weeks away from the 1-year anniversary of the first positive patient we had in Northwest Texas. I can say over the last year, I've seen just very stunning examples of just the very touching and sincere efforts of our staff, as well as the community, to maintain compassion and a human touch, despite all these efforts we've had to make at interpersonal distancing throughout this whole year. And last week was no different. We had a couple here that had planned on getting married in the spring, only for the lady in this relationship to become terminally ill with COVID. So at the couple's request last Friday, our ICU staff, as well as one of our hospital chaplains, Scott, organized and held a ceremony of unity for this couple just hours before this lady finally succumbed to the virus. So just another example of just a bright spot of humanity in what has otherwise been a very dark year for many people. But I continue to be hopeful that things are changing and changing for good. Let's talk about the numbers we have at Northwest. So right now we have 241 patients in the acute care hospital, and that's kind of our maximum capacity on most days. We only have 13 patients who have COVID right now. So that is 2.6% of our licensed beds. So that's fantastic. Way down from upwards of 30% several months ago. We have 46 patients in our critical care units, only 4 of which have COVID right now. So again, much better numbers there. We are using 13 ventilators at the hospital, only 2 of which are being used for patients with COVID. So continued improvement in all those numbers. Now, with regard to our outpatient testing, we actually got down to a 0% positivity rate this last weekend. On one day, we tested over 80 samples and had no positives. We are maintaining well below 5% positivity rate on most days. So again, great improvement there. We have had 22 COVID-related deaths this month, and that is tragic. It is greatly improved though from where we were, and we hope to continue to see this drop precipitously over the next couple of months to where we don't have to worry about people succumbing to this virus. And right now, we only have 5 staff members who are on quarantine. That's down from 130 plus a couple of months ago. So again, everything looking better and better as we hopefully we move out of this viral pandemic. With regard to the remdesivir, that's the drug that we use in the hospital. Right now, we have treated 723 patients. I want to personally thank BSA for their help last week. We had an interruption on supply of remdesivir due to the weather, and they generously let us borrow some last week until we could get our supply in. But right now, we only have one individual currently on that medication for COVID. I agree with Dr. Milton. I was on a call a couple of days ago with the corporate about ivermectin, and based on all the data at this point, UHS, Universal Health Services, is saying as a corporation, they do not encourage the use of ivermectin to treat COVID-19. So really, that drug does not have any role or utility in the treatment of this virus. As regards to bamlanivimab, the outpatient monoclonal antibody that's being given by the city, we treated a total of 172. We have over 300 doses of that available. So again, if you are COVID positive and you feel that you fall into the high risk groups that can receive this medication, please see your primary care doctor so they can make a referral to our infusion center. And lastly, in regard to staffing, we have achieved a 50% reduction in the visiting staff that we were looking for from the RAC that we thought we would accomplish by mid-March. We've already achieved that. We're still being very protective of the staff we have in the emergency room, the ICU, and the respiratory therapy at this point with the visiting staff. I think overall things are looking great. We are, in terms of the hospital, we are not yet reducing our limitations on visitors or on access to the hospital. And I think we have to do the same personally. It's not quite time yet to let our guard down, even though things are much better. I think we just continue to do what we've been doing with regard to masking and distancing. We will get through this in the next couple of months in a much more stable situation. That's all I have for today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA, excuse me. Dr. Gonzalez, how are you?
I'm doing well, thank you. So first of all, I'm pretty excited to announce that today we have 0 COVID positive patients in our hospital. And so I do not know the last time I've been able to say that. So very happy to hear that. We have vaccinated about 19% of our veterans, or about 19% of our veterans in our healthcare system have been vaccinated for COVID vaccine. Now, our positivity rate last week was 2.9% for the veterans that we've done tests on. This week, it's currently sitting at about 3.5%. So, we continue to watch that. We're very happy because I remember when we were up in the 30 and 40%. So much happier to see these numbers. The one thing I want to say, and last week, the VA gave the authority to the medical center directors to adjust how they want to do the vaccinations based on the local need. And one thing that I've noticed is despite having a lot of appointments available, most of those have not gone filled for getting the COVID vaccine. So on Monday, I lowered the age that we can give veterans vaccine to 50 years old. I want to highlight that because I know Texas is a little bit different. We're under federal guidance, and so I'm a little bit different what I can do here. So, but any veteran who wants to be vaccinated, we want to ensure you get vaccinated. So what I would encourage for veterans, please call us if you want to be vaccinated. If we have an appointment, we will get it to you. We have also started reaching out to our rural clinics. About a week and a half ago, we were up at Dalhart. We vaccinated some. We've got a team going to Childress today where right now, I think this morning I heard they have about 80 to 100 that we hope to vaccinate today. Now, when we're going to these rural clinics, we're doing all ages of veterans. Because we know it's limited. We can get there. We can't store the vaccine there. So we have to go down there, vaccinate, and bring it all back. So for the Childress area, it's going to be at that Childress Elks Lodge today, this afternoon. In the next week, we go to Clovis, and we'll do the Clovis vaccination a week from today. The other thing we're doing is in Lubbock and Amarillo are having what we're calling a Super Saturday Clinic. Now, I know Lubbock already has several booked. But they still have room to book more. Here in Amarillo, we only have 5 patients booked. I want to vaccinate more than 5 this Saturday. I've got a couple hundred doses that I can give this Saturday. So please, veterans, call if you want to be vaccinated. Help us get you vaccinated. We have vaccine, we have appointments, and we want to get you vaccinated. Our number, once again, is 806-355-9703, and then press option 2. Last thing I want to say is yesterday was Iwo Jima Day, and many of us remember the iconic photo of the 6 Marines raising the flag on Iwo Jima. But sometimes we forget that over 6,800 Americans lost their lives in that battle, and over 19,000 were wounded. And so just want to, I know we are losing many of our World War II veterans as they are getting older, but I just want to take this time to really thank our World War II veterans. And if you know a World War II veteran, please encourage you to send them a note, pick up the phone, call them, and just thank them for their service. And so, as always, I want to thank the mayor and her team for what they're doing. I do appreciate the public health department and their vaccination clinic. I know we probably have a lot more than 19% of our veterans vaccinated, because I know every time I've been down at the Civic Center, I see lots of veterans there in line getting their vaccine. And so just a reminder to those veterans who got their vaccine outside the VA, please let us know so we can update that record so we know exactly where we're at in getting our veterans vaccinated. And so thank you and have a great day.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good. Thank you, Dave. Just want to remind everyone, like Casey said, that our the public health free drive-through testing site is open. If you have symptoms you feel might be COVID, please call 378-6300. They will screen you over the phone and then refer you to the drive-through testing site. We are also providing free transportation to anybody that needs it to the drive-through testing site as well as the vaccination site. If you need transportation to and from either one of those sites, please call Amarillo City Transit at 378-3095, and they will arrange that transportation for you. And that's from your door to the site and back. We want to make sure that everyone can get vaccinated that needs to get vaccinated, and transportation should not be an issue. We also want to remind everyone that Governor's Orders GA-29 and GA-32 are still in effect and still must be observed here in the city of Amarillo and the state of Texas. GA-29 speaks to face coverings that need to be worn anytime we're out and about, interacting with people not in the family or interacting with anybody out inside 6 feet. So if we can't social distance, if we're not with people in our family, if we're out and about, we'll be wearing those face coverings. That's one of the main things that's helped us be in this positive situation that we find ourselves in right now. Also want to remind everyone that GA-32, as mentioned earlier, is still in effect. That does limit us outside of our essential operations, which can still be at 100%. That limits us in businesses, in restaurants, in other retail operations to no more than 75% of their allowed capacity. The only exception to that is bars, which are allowed to be open at 50% capacity. That's all I have, Dave.
Thank you, Jared. We're now going to go to members of our media who are in attendance today. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with Kevin Welch of News Channel 10. Kevin, how are you today?
I'm good, Dave. Thank you. Casey, can you give us an idea about the supply of vaccine given the cold snap and everything? Have supplies kept rolling in, or where are we?
Yes, our supply is great. We received our next allocations yesterday, and so we are able to vaccinate anybody that's in that 1A or 1B category, and then we're also well positioned with second doses.
Okay, and have you had to adjust the operations any at the Civic Center now that there's more people coming in for second doses as well as the first dosers?
We did make some adjustments early on when we started giving second doses, but the way that we made those adjustments when we first started giving second doses has been very well. Our team did a great job with that adjustment, and so that has carried us through, and we have not had to make any large clinic adjustments since then.
Okay.
And I'd like to add, we have not had the long lines that we saw when we first started doing vaccinations at the Civic Center. Because of the adjustments that Casey and her team and the Civic Center team have made out there, it's allowed us to have everybody inside, to not have the long lines, even when there's a lot of people showing up. So it's extremely well run. A lot of compliments from the public, people who have received their vaccinations on the efficiency, the mood, the attitude. So just because there's first and second doses going on simultaneously right now, we've really gotten really good at managing the flow and making sure that people are there in and out as quickly as possible.
Okay, thank you. Dr. Milton, do you have a sense of the percentage of healthcare workers who have gotten the vaccine? Do you have information on that?
No, I don't have information on that. The Dr. Weiss and Dr. Lamentier may have a little more on that.
Yeah, Dr. Weiss, what about at Northwest?
Well, I would say, so you talk about two. So you talk about the hospital staff.
Right.
So the hospital staff, we were approaching about 40% that have been vaccinated. And those are the ones that wanted it. So we offered it to everybody, and those are the ones that wanted it. So about 40%. Now, if you talk about the medical staff, which is the physicians and providers, I think that is much higher. I mean, we saw physicians, or many of the physicians were first in line. We were given the vaccine. So, and I think Dr. Lamentier kind of alluded previously, they've seen the same phenomenon. About 40% of their hospital staff vaccinated, but a very high percentage of the medical staff vaccinated.
Okay, thank you. Also, Dr. Weiss, can you tell me about you talked a little bit about the RAC nurses. Did I get it right that you had 50% reduction? About?
So the plan as of about 3 weeks ago was that we would have a 10% reduction per week for 5 weeks to get to 50% of those that were in this community about 3 weeks ago. Just through that process, plus through some of the natural attrition of these, we've gotten to 50% of that were here about 3 weeks ago. So we've actually stopped the organized 10% loss per week, and we're just kind of holding that where we are right now.
Okay. And Casey,
Dr. Weiss.
go ahead. Okay, Casey, the A&M Medical Diagnostic Lab down in Canyon converted to where it can process human tests. Does the city get a lot of tests from them? Results back? Casey, can you hear me?
I think we've lost Casey as well.
I think I might be back. I'm sorry.
Yes, we
I'm
can hear you,
sorry.
Casey. Go ahead.
No, I was just asking if the city gets a lot of its test results back from the veterinary diagnostic lab that converted, the one that's down in Canyon now, and now it can do human tests. Do y'all use that?
So we are right now we're mostly using a lab called PPL, and so there may be some partnership there, but we are using PPL.
Okay, that's everything. Thank you all.
Thank you, Kevin. Let's now go to Jacob Helker, KVII Channel 7. Jacob, how are you this morning?
I'm doing well. Good morning, everyone. This first question is for Casey. I know that Dr. Melton was talking about this earlier. The Johnson & Johnson vaccine is on track to be given its emergency use authorization from the FDA. As the first single dose option, have we talked to Johnson & Johnson or any federal officials specifically about securing a supply here? And how do you think that would affect the vaccination rate going forward?
So we are allocated vaccine based on what is our state allocation. So the states are allocated vaccine from the federal government, and then the states allocate down to local health departments or providers. And so we don't really get to ask about a specific allocation or make that request, although our request is known, but we don't get to make that request of the federal government. So our states work with our local providers to make sure that allocation is equitable throughout the state. And so we will give vaccine that is allocated to us. And so we're excited about having additional vaccine allocation regardless of the brand. So I hope I've answered your question. I think I kind of rambled a little bit, but.
Oh, definitely. Okay, this next one is for the entire panel. I know now we're coming up on, by my record, about 2 months of when nearly daily active case falls and hospitalization decreases kind of became the norm. So with a lot of doctors around the country saying COVID-19 is probably not going to ever go away completely, what do you think about any permanent changes in either how the city operates or the citizens here in Amarillo live life, even after the pandemic tag has kind of been taken off of the situation we're under?
I think that's a good question, and I'm not sure that I can answer, any type of permanent rules or something that would be put in place, potentially for the future. I do think, though, that this pandemic has changed everything, and I think it may be something that's more a personal choice of some individuals down the road of how they're going to approach even other contagious illnesses like the flu, et cetera. I think that there's probably going to be more people that are going to be okay with wearing a mask. That's how kind of I feel about it. I think that those are more personal choices than I think that things that we kind of legislate. And really I think that's one of the morals of this whole thing. It really does boil down to people being compliant and making a personal choice to protect other people's by wearing a mask. But I do think that there's going to be some behavior that will be changed in the future. I don't know how anybody else feels on the panel about that.
Yeah, David. So I have not actually left my house in 10 months. I think what you're gonna see is one thing you'll see a lot more of what we're doing right now is instead of personal meetings or congested meetings, maybe meetings electronically and digitally. I think in the hospital, we are going to have a new norm in terms of how we screen patients for suspected COVID, because again, we don't want the risk people contracting the virus in the hospital, particularly when they're undergoing surgical or interventional procedures. We will continue to screen those patients to protect them, to protect our staff, to protect the physicians. So I think that's going to be just incorporated in our daily routine at this point for maybe quite a while, as to just making sure that we are vigilant about screening for this virus and taking care of those people appropriately who do turn out to have the virus active.
Go ahead, Jared.
I was just going to say, Dr. Weiss mentioned virtual meetings. From an operational standpoint, we have invented new processes as far as the city organization goes to be able to provide good customer service virtually and through curbside service. And I don't think any of those things are going to go away. We're definitely going to go back to being able to provide that good face-to-face customer service. But we have more options, more tools in our tool belt, in our tool chest, to be able to provide service to our community and to our team. So I think there's lots of things that we've learned that are going to be very beneficial long term. The doctors can probably comment better. We'll leave the face coverings alone for long term, but from a personal hygiene standpoint, from a sanitization inside the workplace standpoint, there's been a massive impact on the quality of life that our employees have. Yes, there's been this big threat for coronavirus, but the yearly impact of flu and other things has just not happened this year. So if we're not actively dealing with coronavirus, our teams have been, our residents have been more healthy. Now we have, as Casey said, almost 700 people we've lost just in our two counties to coronavirus. So in no way am I saying this is a good thing, but it is teaching us habits that will be useful going forward forever. So there are things that we have learned. Mayor.
Yeah, I agree with that. I think we were all forced in the same foxhole quickly together. And while we've been in there, we've accomplished a lot, and we've seen the value. Foxholes build some unique relationships, and they're tight bonds built in a foxhole. So again, I referenced that about the people that are on this panel, the work that they do off of the press conference time together. These are foxhole type relationships. And so the benefit that we have from these friendships, we all have each other's cell phone numbers now, and we talk offline about other things. And even I just think back, amazing the work that's been done, whether it was developing the gel that holds the tests because we didn't have VCM, or converting a lab like the A&M lab, or so many hurdles that the teams have jumped over together. That teamwork skill and the relationships, those aren't going away. And those will benefit our community no matter what challenge sits down in front of us. One of the challenges that is going to sit in front of us that's been revealed by COVID is the fact that many of our students in the city do not have equal access to broadband. And it affects their ability to learn, whether we're in a virtual learning, actual all-in pandemic mode, or just so much of school, basic school, happens in an online, or at least with online access to complete assignments. So that's something the city will look at, and we're excited about partnering with our school districts to try and accomplish closing that gap so that everyone in our city does have that basic access to broadband. And I think that's going to be obviously a huge positive. We might not have had that on such an accelerated or broad response, but for COVID. So there will be things like that as we process post-COVID. We'll move past these, or we'll embrace them a little bit, you know, on a personal level. These will be a personal choice instead of a government order, I think. But there are many long-term benefits that we will have as a result of this struggle. And we didn't choose to go through it, but we are choosing wisely to make the most of it.
Definitely. Thank you, everyone. I have one more question. It's more of a logistical thing.
Sorry, Jacob, I think we lost you there.
Sorry, you got me now? Can you hear me?
Yes, we can.
Okay, sorry, y'all. So for Casey, we've had a lot of worried messages from viewers over the past few months who have received their first dose of the vaccine at the Civic Center and then have either misplaced or you know, their vaccination card is somehow not available. So what options are available whenever that happens?
Jacob, that's an easy one. So if they come, we have a bank of computers that are set up and staff ready to assist so that we can look them up in M-Track when they come to clinic. So if it's been 28 days since they got their first shot, they can come tell our staff that they're ready for their second shot, but that they don't have their card. It might take them just a little bit longer than if they had brought their card, but we can certainly help them, and we're ready to help them.
Well, that's all I have. Thank you, everybody.
Thank you, Jacob. Let's now go to David Gay of the Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. Just a follow-up on Jacob's question regarding the Johnson & Johnson vaccine. I know that Dr. Melton said that passed EUA today. Is there any word on how what requirements that vaccine is storage-wise? Will it be stored the same way the Moderna is, or does it have to be frozen or in that type of cold atmosphere, as cold of an atmosphere as the Pfizer vaccine?
Go ahead,
sir.
Go ahead.
It won't require the ultra cold storage like Pfizer. And so whatever requirements it requires, if it's frozen or refrigerated, we all have that capacity to store the vaccine.
Okay, and then just to follow up, because of that, is that once it's allocated to various places, will that be given as a choice at the clinic? And will, I guess, individuals have the choice whether to have the 2 doses of the Moderna or the 1 dose of the Johnson & Johnson, or is that just an ongoing conversation that's being had at the city level?
That's a great question. So, you know, I'm not exactly sure how that will roll out. It probably depends on which vaccine is allocated. If we have both, or if we just have the one, or if, you know, so I don't know exactly how to answer that, but there will certainly be more to come as information comes out to us, especially on if we're going to be getting the additional vaccine, or if we'll be allocated just the Moderna vaccine.
Absolutely. I think that's all the questions I have. Thank you, guys. Have a good rest of your week.
Thank you, David. Let's now go to, if I'm not mistaken, Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good, thank you.
First question is, we continue to see our numbers drop, the percentages drop, and all that. Are we looking at possibly dropping to status level yellow soon?
So we are in status level orange for the 2 weeks, and then we'll certainly be assessing those indicators that have been assigned to each of the different status levels, and we'll move accordingly. So yes, we're always watching the numbers, and we'll be glad to move as soon as the numbers tell us we can.
Alrighty. And Dr. Milton and Dr. Weiss mentioned the ivermectin earlier, and ironically, when I had COVID last month, that's what I was given, and we keep hearing more and more local doctors are giving that. What are your thoughts on that being prescribed?
Well, there's no scientific justification for it, and it's not an approved treatment for it, and there's just no data that supports the use of it. So if I'm ever asked that question, that's what I tell people, and that's the truth.
And same thing. I mean, you can be confident that you're free of worms at this point, but the thing is, the other problem is some of the dosing of it is at levels significantly above what are considered standard dosing. And so we talked about the fact that there may even be evidence or concern about toxicity at some of these levels. So I agree with Dr. Milton that there's no evidence to support its use. The company that makes it, I believe Merck, came out and said, we don't support its use, that we have no evidence that's of any utility in COVID-19. So I think it's one of those things that unless there's other studies that come out that show differently, at this point, there's really no reason for that to even be considered in treating someone with COVID-19.
Thank you, and I'm glad I'm COVID and parasite free. Another one along that line. I guess there's been a study saying that ivermectin could be good for anti-inflammatory properties. Would that, if that is the case, would that be something that could help with COVID?
I'm not sure how you answer that. I mean, I think that there's probably lots of different medicines that if you took them at certain dosing, et cetera, that you're going to have some nuances that may imply that may be beneficial, but that's all kind of anecdotal information, and you really kind of have to look at the data and look at the studies that have evaluated the drug, and the bottom line is it's just not useful.
And I'd say, just to kind of follow up, there was a drug that we talked about early on called tocilizumab, and tocilizumab is a monoclonal antibody against interleukin-6, which is an inflammatory cytokine. And again, the thought was, hey, if people are dying from these cytokine storms, maybe if we give these medicines that somehow interrupt that process, people will do better. I can tell you a study came out on tocilizumab within the last month or so, and they were able to show maybe a marginal improvement in just a very small population of patients. So that's one of the most powerful kind of anti-inflammatory drugs we have, and it just has not been bearing out that it's of any real strong utility in treating COVID-19.
All righty, thank you. And Dr. Weiss, you said that y'all are a bit ahead of schedule on reducing the number of RAC staffing that you are using. How has that affected, I guess, the basic, the normal staff of Northwest and having to shuffle around there?
Yeah, that's a good question. So I think both Dr. Lamentier and I have alluded to the fact that we've struggled with a lot of our employed nurses and staff leaving to travel to other areas, with the opportunities at some of these other hospitals. So I think certainly both BSA and Northwest have had a significant turnover of staff in the last year because of the dynamics of the situation. The good news is we're able to hire a lot of these folks back now. So as the RAC nurses decline, we are very actively recruiting and hiring back a lot of the staff that we lost. So I think right now the transition's been working well in terms of just replacing these these nurses and staff that came in to help us from outside, and just now putting them back with more permanent staff.
All righty, I think that'll have me covered. Thank you.
Thank you, Aaron. That's all the questions we had from our media members today. This concludes our weekly news conference for the latest in COVID-19 information for the Amarillo community. I'm David Henry, Communications Manager for the city. I want to thank all of our panel members who took the time to provide this information to us today.